Hello friends, I welcome you all to my new episode of our future midwife. I have completed all the antenatal and postnatal conditions. So today onwards I am planning to move on to the newborn conditions. So today's class consists of essential newborn care. Actually, what do you mean by a normal healthy newborn? A normal healthy newborn should deliver within the term. That means 38 to 42 weeks of gestation. And also baby should have a normal birth weight. The baby should cry immediately following the delivery. Also, baby has to establish a independent rhythmic respiration. And also the baby should quickly adapt to the new environment. So once the baby completed all those criteria, then only we can say the newborn is healthy. In case of a healthy newborn, mother can provide essential newborn care under the supervision of a nurse or primary health care providers. In some hospital, after the delivery, if the newborn is normal and healthy, they will keep the newborn in a nursery instead of keeping with the mother. So this is not a good practice. I suggest always, if the baby is healthy, always we need to keep the baby along with the mother. We can move on to the immediate newborn care. So immediate newborn care include maintenance of temperature, establishment of open airway and circulation, identification of newborn, vitamin K injection and initiation of breastfeeding. So first we'll see the maintenance of temperature. So in order to maintain the temperature, soon after the delivery, the baby should be kept over the mother's chest. The baby should receive the first temperature from the mother. It will lead to maintain a bonding relationship with the mother and child. So next we can wipe out the excess vernix caseosa. After that we have to cover the baby with a woolen cloth. Baby's head should be covered with a cap. If necessary, we can cover the arms with a woolen gloves. Then we can keep the baby in the radiant warmer for a few hours if it is indicated. Otherwise, if the baby is healthy, we can keep the baby along with the mother. So rooming in has to be practiced from the beginning itself. So all these measures we can maintain the newborn temperature. Next will be the establishment of open airway. So how we will establish the normal airway? Usually the newborn will cry immediately after the delivery. Once the baby cries, automatically the baby spontaneously takes respirations. Immediately after the delivery of the head, the nurse should suction the nose and mouth in order to drain the secretions. After that, we have to keep the baby on his back and turn the head to one side in order to drain out the extra secretions. So instead of keeping the baby on the back, we are not supposed to keep the baby on the abdomen. So that will suppress the respiration again. Actually, what is the importance of suctioning? As the fetal chest passes through the birth canal, it is compressed, squeezing excess fluid out of the lung prior to the baby taking its first breath. After several seconds, in this partially delivered position, fluid can be seen streaming out of the baby's nose and mouth. After birth, baby will be cough and sneeze, mobilizing additional fluids that may be in their lungs. So these are the few natural mechanisms which helps to maintain the proper airway. Next we'll move on to the Upscar scoring. It is very important to take the Upscar scoring soon after the delivery and after 5 minutes of birth. So Upscar scoring has some criteria such as respiration, heart rate, muscle tone, reflex response and skin color. So we can give the scoring 0, 1 and 2. So in case of respiration, if the respiration is absent, we can give a 0 score. If it is slow and irregular, we can give score 1. If there is good cry, we can give score 2. So when it comes to the heart rate, if the heart rate is absent, we can give 0 score. If it is slow, that means below 100, we can give score 1. If it is more than 100, we can give score 2. So in case of muscle tone, if the muscle tone is flaccid, we can give 0 score. Some flexion of extremities are present means we can give score 1. Active body movements are present means we can give score 2. In case of a reflex response, if there is no response present, we can give 0 score. If there are some kind of grimaces are there, we can give score 1. If the baby is having good cry, we can give score 2. The last one is skin color. If the skin color is blue or pale, we can give 0 score. If body is pink, extremities are blue, we can give score 1. If the baby is completely pink, we can give score 2. The total score of Upscar is 10. If no evidence of respiratory depression means the score will be between 7 to 10. If the child is having a mild depression, the score between 4 to 6. If the score comes 0 to 3, which indicate the baby is severely depressed. Next is the newborn identification. Usually we are providing newborn identification with the help of a identification bracelet. Usually we keep it over the baby's hand. Then next one is the footprint. Usually we take the footprint of the baby, and these also indicate the identification tag for the newborn. The next immediate newborn care is administration of vitamin K. So administration of vitamin K is very important for the newborn in order to prevent the newborn hemorrhage. So the first few days the newborn is unable to produce the vitamin K. So there is a chances of getting newborn hemorrhages. So for preventing that, we are giving vitamin K injection IM. So usually for the term baby 1 mg we are giving. So in case of preterm baby 0.5 mg we are giving as an IM injection. The next essential newborn care is initiation of breastfeeding. So as soon as the delivery of the baby, it is very important to start the breastfeeding. So baby has to be put on to the breast within 30 minutes of delivery, which helps for the bonding relationship between the mother and baby. Now we'll move on to the daily routine care of neonates. The majority of complications of normal newborn may occur during first 24 hours or within 7 days. So close observation and daily essential routine care is important for health and survival of the newborn baby. The major goal include establish and maintain homeostasis, stability of normal physiological status. The daily routine care of the neonate include warmth, breastfeeding, skin care and baby bath, care of umbilical cord, care of eyes, clothing of the babies, general care, observation, taking anthropometric measurement, immunization and follow-up and advice. First we'll move on to the warmth. Warmth is provided by keeping the baby dry and wrapping the baby with adequate clothing in 2 layers, ensuring head and extremities are well covered. Baby should be kept by the side of the mother. Next is the breastfeeding. Breastfeeding the baby should be put on to the mother's breast within half an hour of the birth or as soon as possible the mother has recovered from the exertion of labor. Next is skin care and baby bath. The skin should be cleaned of blood, mucus and meconium by gentle wiping before he or she is presented to the mother. Baby bath can be given at the hospital or home by using warm water in a warm room gently and quickly. Next will be the cord blood collection. Make sure cord blood is collected for analysis and sent to laboratory for checking of Rh blood type, hematocrit and possible cord blood gases. The care of the umbilical cord, so which include keep the cord stem clean and dry. Topical application of antiseptic is usually not necessary unless the baby is living in a highly contaminated area. Care of the eyes. Eyes should be clean at birth and once in every day using sterile cotton swabs soaked in sterile water or normal saline. Separate swab for each eye. Next is clothing of the baby. The baby should be dressed with a loose, soft and cotton clothes. The frock should be open on the front or back for easy wearing. Large button synthetic frock and plastic or nylon napkin should be avoided. The general care includes rooming in, gentle approach, aseptic technique, sensory stimulations, tender and loving care. Next we'll move on to the anthropometric measurement. Anthropometric measurement include height, weight, head circumferences and chest circumference. The first one is weight. The average daily weight gain for healthy term baby is about 30 gram a day in the first month of life. It is about 20 gram per day in the second month, 10 gram per day afterwards during the first year of life. Next is the length. Length should be measured from the top of the head to the heel with the leg fully extended. The average range between 18 to 22 inch, that means 46 to 56 centimeter. Next is head circumference. The head circumference should be repeated after molding and capute succeedinum are resolved. The average range of head circumference is 33 to 35 centimeter. Normally 2 cm larger than chest circumference. Place tape measures above eyebrows and stretch around fullest part of the occipital at posterior fontanelle. The chest circumference is at the nipple line. Average range between 30 to 33 cm. Normally 2 cm smaller than head circumference. Stretch tape measures around the scapula and over nipple line. Next is the immunization. Newborn should be immunized with the BCG vaccine and 0 dose of OPV hepatitis B vaccine can be administered at birth as first dose and other 2 doses in 1 month or 6 months of age. Follow-up and advice. Each infant should be followed up at least one every month for first 3 months and subsequently 3-month interval till 1 year of age. There are few traditional and cultural newborn practices which we are not promoting nowadays. So that I will display on the slide. Please have a look on that. I think this is enough for the essential newborn care. So next class we will meet with another episode of newborn condition. So till that, take care. Bye bye.